Hi, it's Dr. Noel Williams, October 26, 2020, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update. A lot of talking points today. I love mumbling as I start. Let's go over statistics. About 1,800 cases on Friday, biggest day we've just about had in Oklahoma. 1,500 cases roughly on Saturday, 1,000 cases on Sunday. About 1,825 deaths in Oklahoma. The rest of the country, we're at 230,000 deaths. Averaging about 80,000 cases a day. I think it dropped to 63,000 yesterday. So COVID's booming. And so is it booming because people aren't following directions? Ask yourself that for a second, because this is part of our talk tonight. The answer is no. It's booming now because it is a fall, winter, cold virus. Coronaviruses are fall, winter, cold viruses. Influenza is a fall, winter, flu virus. But COVID, as a corona cold virus that causes significant illness, is going to proliferate now. So all the things that we did to mitigate or delay, so mitigation means delaying or trying to avoid something, the damage, those strategies are not applicable in the active part of the pandemic so much, because the pandemic is everywhere. The viral particles are everywhere. Now we're in the time of the year where they can proliferate, go everywhere, reproduce. It's 42 degrees Fahrenheit is the magic number if you're an American. Celsius, I don't know, 5 degrees. I'm guessing, someone can correct me. But the bottom line is, it's the wrong temperature and the wrong humidity for most of the country, so it's going to proliferate here and in Europe. It's in Russia. It's what's going to happen. So we had the break from the mitigation strategies, which we did not do correctly, but we had some break because of those, and there wasn't as much virus around. But as it penetrated into our society and across the world, it's been there, but with the temperature change, it proliferates. That's what happens. And so when we think about doing things to fight the virus now, it's not about mitigation. It's about, what did we learn? Well, we've learned that this is a virus that affects people who are already ill or old. And so what's the common denominator? Their immune status. It isn't about wearing a mask. It isn't about washing your hands as much, even though I want you all to do that. It's about your immune status. And that's the truth, and it's the most important thing. And if your immune status is good, your risk of getting a significant viral illness is low. If you then get a viral illness and you actually do an intervention, which in COVID's case is Plaquenil or potentially steroids or antibiotics, you are going to do very, very well. The problem with what we're experiencing in the United States and Europe is the loss of rational scientific thought. And because of that, the theory of, we'll do Tylenol, and then the ones who get sick enough will then treat with remdesivir, which really works very poorly, if at all. Antibodies that only a very few group of people can get. Dexamethasone, which works really well. Some other experimental therapies. So we've gotten really good at treating the sick people, but the goal is to never let people get sick, which I've gone on and on and on about. So mitigation is not the solution. And if you look at California, which came out with these totally screwball rules for Thanksgiving, so for 3 days, not more than 3 households can be together. You have to wear your mask as much as possible. You have to eat your Thanksgiving dinner outside. They recommended against speaking loudly, singing, or using wind instruments. I mean, it's just one that's, and okay, this is political. That's complete government overreach. Having a governor just say, this is what you're going to do. If anyone thinks that's okay, turn me off again. Because I've been an American for 55 years, and that isn't how we do things. And doing something like that, not based on science or any evidence that it would help, but about power, plus it's not enforceable, is silly. It's silly. It doesn't work. And all those people who it affects gives them a false sense of security. It would have been much more meaningful for Governor Newsom to say, everyone take a multivitamin, everyone take vitamin D, everyone take some zinc. That would make a difference. What he's doing isn't going to make a difference and just causes further divisiveness in our country. So that's the end of that subject. So when we move forward now, It's about nutrition. It's about having a relationship with a provider that can give you help. I still understand that throughout the country and throughout the world, most people don't have access to providers who are going to write for Plaquenil or dexamethasone or antibiotics to cover secondary infections. But that's really what you have to try to find. But in the meantime, pulse your zinc if you get COVID or get exposed. And let's talk about exposure for a second. If let's say you go to a church for a service and you hear later that someone at the front of the church had COVID and you were sitting at the back of the church, is that an exposure? It's not an exposure. That's not an exposure, okay? A true exposure is you're face-to-face predominantly, or within, I think technically it's face-to-face, but if you're within 6 feet of someone, is the technical thing, not face-to-face, within 6 feet of someone for 15 minutes who pops positive for COVID, you've been exposed, okay? It's 15 minutes, 15 minutes, 15 minutes, 15 minutes. It's not 5 minutes, it's not 7 minutes, it's 15 minutes within 6 feet. Now there's exceptions. If someone's a loved one, they don't have their mask on, they give you a kiss on the cheek and they pop positive for COVID, and it's been within the last 2 or 3 days you saw them, then no, that's a primary exposure because they actually touched you with their mouth, or if they touched you with their hand, because if they had it on their hand, that would be a direct spread, not coming across the air. So that's a primary exposure. And if you have a primary exposure, you should be checked usually about 4 days after the exposure, because if you're going to be positive, that's when really it's day 3 to 4, but 4 is a better day. And you're really going to start becoming potentially infectious day 3. So do the zinc pulse as soon as you know, take your vitamins. If your test is negative and you're asymptomatic, chances are you're not going to get it, but you still watch for symptoms. You can repeat your test at day 7 or 8 if you're feeling nervous. If that's negative, that's very reassuring. But it's really 14 days from your exposure without symptoms that you're out of the woods in terms of getting an infection or spreading the virus. And so that's why it's a 14-day quarantine. Repetitive testing is not equal to just the time and being symptom-free. Plus, we know there is a small group of people who are asymptomatic who can spread the virus. Now, when you're asymptomatic, it's highly likely you are not as infectious as someone who's sick, but there's still that possibility, and that's why the recommendations are 14 days. Exceptions, essential workers. Let's talk about essential workers. The healthcare providers, police, fire, government officials. That would include the governors of places, legislators, the vice president, the president. I think it's hilarious, again, that we've ruined science so much that you wouldn't consider either Joe Biden or Mike Pence or Kamala Harris, essential right now since they're running for president. But that's me again. Let's be realistic. As long as they're negative and they keep their distance, blah, blah, blah. But we have to have some rationality to this, and it's just getting very, very wearing for everyone who wants people to be rational and people aren't. So that gets then to the one thing that we haven't ever talked about in any detail. What are the psychological ramifications for everybody with this? Well, if we look at what's going on sociologically, depression rates are increasing, suicide rates are increasing, domestic violence rates are increasing, and there's a lot of negative to this constant pressure. We see in our office tons and tons and tons of people who are depressed and anxious, much more so than usual, and we haven't even gotten to the holidays yet. And it's from the COVID effect of being at home and all the pressure. And it's important for all of us to be understanding to that and realize this is going to be a saga for the next year or two. Because let's say COVID blows over finally, God willing, at some point in the next 6 to 12 months. Or there is a miraculous vaccine that is truly effective and it's truly safe. There's still going to be ramifications for another year or two, just in terms of getting things back to normal, getting our freedoms back, being normal, not being fearful. There's going to be people who are going to be fearful of viruses now forever because of this and the way it's been handled. And so we have to just understand there's been a big psychologic effect that's really unfortunate, but I don't know there's not a lot we could have done about it in some respects. But realize that and be nice to people. And so I would focus on that too. So that's my general statements for this evening. You need to be very, very careful. You need to take your supplements. That needs to be your primary focus. I think anything else is secondary at this point. The virus is going to spread. You are going to get exposed to the virus no matter what you do, unless you stay in your house locked down and never leave. That's it. That's the only way. If you leave your house, you're going to get exposed to the virus virtually every time. We know 30% of people have cross immunity from coronaviruses already from multiple studies, so that's a positive. We know if people's immune systems are ratcheted up with zinc and their alpha interferon is high, they're very unlikely to get ill. We know vitamin D levels matter. We know testosterone levels matter. We know these things, so let's act on it. We also know that there are treatments for outpatient, as just documented by Harvey Risch, who is the head of epidemiology at Yale. There's more and more data. So don't panic, be pragmatic, take care of yourselves. So what questions are there?
Okay, with the colder weather, will the disease manifest in a more severe way with people, or is it only that you're more likely to get it?
I think there's more viral particles around, so you're more likely to get it. It's not going to be more severe. And we look at the mutational data so far. The only mutational data that has been a little more significant is the virus has gotten maybe a touch more infectious. I haven't read anything in the last month or so on that, but about a month and a half, 2 months ago, there was some data on that. But there's just a lot more viral particles, so it's easier to get infected. And it can last longer because hot surfaces could kill it. It works a lot, it survives a lot better in a colder, moister environment.
Okay. You talk a lot about supplements. Would it be better to get your nutrition from food? And the person mentioned specifically like pumpkin seeds and zinc.
And so the answer to that question is yes, if it was 1935, but it's 2020. And I always use this as a marker. There was a paper in 2010 or so. It takes 12 bowls of spinach, even from Whole Foods or Sprouts or somewhere like that today, to equal the nutritional value of a bowl of spinach from 1935. And that's pretty uniform across all vegetables and fruits. So the reason we have to do supplements is because the nutritional value of food is so bad. And it comes not just from the soil being worn out, it's from the seed sourcing and genetic modification. So yes, I'm sure some of the vegetables at Sprouts are better than some of the stuff you get at other stores. But the net effect is still minor compared to what it used to be. So when we're thinking about, hey, we have a major pandemic, you take the vitamins. And so like pumpkin seeds have zinc. So it's 100 grams of pumpkin seeds to get 7.5 milligrams of zinc. So my bottom level dose is about 15 milligrams a day. So that's 7 ounces of pumpkin seeds a day. That's a lot of pumpkin seeds to eat. And so, yes, if you want to do that and you can do your measures of your macros to hit all these different things, good luck. You can do that. But it's probably not realistic. But if you're highly, highly motivated and you can get up to 20 to 30 milligrams of zinc through eating pumpkin seeds, and you can get enough vitamin D, and you can get enough of your Bs and all that, then you get the actual levels measured, then it would be adequate. And in a perfect world, yes, we could all do that. But it isn't a perfect world. Our food sourcing isn't perfect. So nutritional supplementation through supplements is preferable and easier for most people and more cost effective.
Okay, and the rest are all about supplements. Some of this we've gone over, but again, there's new people or people need it rehashed. So fish oil amounts.
So omega-3, your baseline dose for everyone is 750 milligrams. And fish oil can have EPA or DHA in it. The EPA portion always needs to be greater. It's 3 to 1 or more. So if it's a 10 to 1 EPA to DHA, I'm totally good with that. We're using the EPA predominantly for disease prevention and to prevent clot. And so that's why we like the EPA better. And we like the anti-inflammatory effect we like the disease prevention effect. The DHA, which is also neurologically active, anything at 60 to 80 milligrams is going to be plenty. But the EPA is really where you want to focus. So about 750 milligrams a day as a baseline. If you're someone with lots of risk factors for cardiovascular events, blood clot, you may want to talk to your provider about more than one a day. And there may be times where you would take 2 twice a day if you have rheumatologic disease.
And stay on that same amount if you
and if you get COVID, you need to talk to your provider. What we do is we usually bump people up to 1 twice a day if they're low risk, and then more if they're high risk. And sometimes we might even add a baby aspirin. Now, younger people, in their teens or 20s, a lot of them aren't on fish oil, so if they get COVID, we ask them to take 1 a day.
Okay, same question on melatonin.
Melatonin baseline for COVID is 1 to 2 milligrams every day. If you get infected, you want to bump it up to 10 if you can tolerate it. Tolerability with melatonin is important because it can make you sleepy or it can make your dreams really, really vivid, and occasionally that's unpleasant.
Okay, and then zinc questions. People were confused with your last video when you said if you've been on zinc for a while, then go to every other day. Mm-hmm. So if you are now going every other day, do you still take weekends off?
No, I would just do every other day.
Okay, so you're doing every other day all through the weekend too.
All through the weekend too.
And then if you're doing pulses, do you still, once you go back on it, then do you go to every other day?
Yeah, so if you do a pulse of zinc of 150 to 200 milligrams, you then take the next 2 days off. And then if you're doing the pulse, it's because you either got exposed to COVID or you have COVID or you have a cold or flu virus. So typically you do a pulse on day 1 and do another pulse on day 4, wait 2 more days, and then you just go back to 1 every other day.
Okay, I think you answered most of those just then. So whether you actually test positive or you're just feeling sick, you do it day 1
and day
nothing, and then day
4 you do the pulse again, because remember, the central theory on zinc is it's active against all RNA viruses. So the vast majority of your cold and flu viruses are RNA viruses. So you're always treating them with the zinc. And that's the other thing. So if we guess wrong on Plaquenil while we're waiting, Plaquenil is pretty active against most RNA cold and flu viruses too. It has some level of activity. So it's not like it's the end of the world if you take it for a few days.
So what if you're a teacher or a healthcare person and you're doing zinc pulses for prevention? What's your protocol then?
I think what we would generally have you do is take our study is 150 milligrams once a week, and then you pulse it a second time during the week if you ever get sick. Another way to do it would be do a pulse on Sunday and then do 30 to 50 milligrams on Wednesday, just as a single dose as an augmentation. But I think you do a baseline 150 once a week, and then you could do 30. The thing is, when you're pulsing, you get a super high level that can really kill viral particles, and that's different than just suppressing all the time. I mean, the healthcare worker and teacher thing is, you could do a pulse just twice a week too, 150 and 150 if you can tolerate it. That would be fine too. The problem with zinc, though, always is the labor intensity of its effect on the GI tract and upsetting your stomach. So again, this is one of the things that is hard in medicine sometimes for people to understand. There is no one right way. Okay, it's like if you get a bladder infection and Dr. A gives you Bactrim, and Dr. B gives you Macrobid, and Dr. C gives you Keflex. All of those are fine to do. And so there's just the thought process, which is the hardest thing to understand, is we have flexibility in how we approach the zinc. It's like, why do I have people take Flintstones? Because they can tolerate it. So if you take 10 milligrams every day of the Flint, now that would be the one thing. If you're taking a Flintstone, you can take those every day because it's only 10 milligrams, so you're not deactivating your absorption. Okay, there were a few other things I was going to talk about, but with all this chaos and bad weather in Oklahoma City, can't think of anything else. But be calm, be nice, and don't be spastic. Okay? Don't be spastic. You'll be fine. Good night.